Hello, I'm Justin Long, Managing Director of Investment Advisory Services here at Class Research.
I'm Sean Howell. I'm an Insights Director here at Class Research.
And joining us today is Brian Clemenhagen, Managing Director of TripleTree, our marquee sponsor of this year's 2022 Digital Health Investment Symposium. Glad you could spend a few minutes with us, Brian.
Thanks for having me. Looking forward to it.
Brian, you've attended this event now personally for a few years, and you know we bring together a very intimate group of investors, innovative tech company leaders, and providers to spend a day and a half up in the mountains of Park City, Utah. To start off with, why do you think DHIS is so important to healthcare?
Yeah, thank you. We've had the good fortune of being a participant for many years, and we do think it's a great forum for really accomplishing a couple objectives in terms of allowing the perspectives of healthcare investors and innovative healthcare companies and the provider community actually to convene. So we think it's a real great opportunity to discuss the topics that shape the future of healthcare and do so in a way that allows leaders and investors and innovators to connect through relationships with one another towards that advancement of healthcare. And so it's a terrific venue to facilitate that level of collaboration and interaction.
While there is always a push to increase the attendees to 2 and 3, and even we've had requests to even push it to 500 internally as well as externally, we feel keeping it to that more curated group is really what brings value to solve some of the challenges, not solve, but tackle some of the challenges that are important in healthcare. So,
Brian, knowing that your focus is provider technology, what have you been able to glean from past participation at DHIS?
We think it's an exceptional way to stay on the cutting edge of innovative companies and new developments and build those relationships fairly early on with companies that are helping to pave those new roads specific to the future initiatives for providers and correspondingly, hopefully look around some of the proverbial corners as it pertains to what innovations are going to thrive and survive in an environment that is perplexing and constantly changing.
You have to have the right people in the room, and I think, you're insinuating that, or in some ways. The group that we invite, there's a certain level within the organization we're wanting, right? So it is the right people that are movers and shakers that, as you mentioned, that can help move the market forward, maybe in different words. So that's what is ultimately exciting about this event. While there's so many levels in an organization, we want those decision makers and those that will have the most impact in these really powerful conversations or networking opportunities will exist there.
Mm-hmm. We really appreciate the partnership with TripleTree each year with this. It's very valuable to us as we're trying to create this experience and move the market, like Justin said. So Brian, one of several key topics that will be covered at DHIS this year is hospital at home, acute virtual care, and other alternate approaches to care delivery, some of these new approaches. When you think about the change in care delivery, where is the industry moving from your perspective?
So we've been talking about the whole notion of tech enablement and the consumer empowerment of healthcare for decades now. And I think if you look at, rewind the clock, the past couple of years, the COVID pandemic has only been an important catalyst, probably putting gasoline on the fire specific to some of those initiatives in terms of advancing new capabilities, new sites of care, new technologies, frankly, kind of reassessing how we think about care delivery and the constitutes for that. And so largely speaking, it's an area that we think is very, very important as we think about the go-forward initiatives. We don't think it's a pandemic-related only initiative, but it's something that is going to be driving healthcare's experience and the optimization of outcomes for everyone involved. And so we think it's a critical and important topic.
Absolutely, and we are filling up very quickly. There are some seats remaining, so for those who are ready or are interested in more information about DHIS or would like to register, please, the event, once again, is September 13th and 14th at the beautiful Stein Eriksen Lodge in Park City, Utah. And you can go to the classresearch.com website for registration. Reach out to one of your points of contact at Class, or if you have affiliation with TripleTree, they will also have some reserved seats available to join this year's event. Brian, thank you again for spending a few moments with us. We look forward to seeing your colleagues up at Park City here in a few months.
Thanks so much. Thanks for having me.
Bye-bye.